The honourable member for Strathmore Brooks, followed by Strathcona-Sherwood Park.
Thank you, Mr. Speaker. This government continues to cause harm to the delivery of health care with its negligent Fredicare approach to pharmacies and drug pricing. A pharmacist from my constituency estimates Torbol, a pain medication, will cost consumers 300% more than what is currently paid. Furthermore, the very basic drug penicillin has been delisted and will no longer be covered by insurance. So, would this health minister like me to arrange a meeting with him, with healthcare professionals, on the importance of penicillin, pain medication, and pharmacies?
Mr. Speaker, we are in touch with pharmacists across the province, and we were very pleased about a week ago to announce $40 million in additional support for pharmacists during the transition to the lower price in generic drugs. The honourable member is incorrect. Penicillin is available in Alberta, and as with all of our drugs, Mr. Speaker, we have multiple manufacturers that are able to provide the drug with the same active ingredient, and therefore we have the ability to deliver on our commitment to get the lowest possible price for drugs for Albertans.
Honourable member.
Thank you, Mr. Speaker. Given that many pharmacists that have talked to me have stockpiles of drugs affected by the imposed 30-day washout period, and given this is not enough time to move the products, when will this government listen to pharmacists, stop meddling in the drug market, and extend the washout period in order for pharmacists to recover those costs?
Honourable members, just be reminded that you've got another 3 hours on health estimates today. So, honourable member, if it's a policy-related type answer you wish to give, proceed.
Well, Mr. Speaker, the policy of this government is to deliver the lowest possible drug prices for Albertans, and that includes generic drugs. Mr. Speaker, the honourable member is correct. We have provided a 30-day washout period, as it's termed, to allow pharmacies that have purchased drugs at the higher price to sell those drugs at the higher price. Mr. Speaker, we consulted with the Alberta Pharmacists Association on this decision, and all of us in the government caucus consulted with pharmacists in our own constituencies. That, with the other measures we've introduced, Mr. Speaker, is providing extra support to pharmacists during the price reduction.
Honourable member.
Not according to my pharmacists, but given that pharmacists in my constituency are saying that this Fredicare will force them to close their doors, leaving patients without access to essential part of health care, when will the minister explain to Albertans and pharmacists why this government is trying to drive them out of business?
Honourable Minister.
Well, Mr. Speaker, nothing could be further from the truth, and the honourable member, if he hasn't already done so, should discuss with his pharmacists the opportunities under our professional pharmacy services framework for pharmacists to be treated as full members of the healthcare team. And that, of course, Mr. Speaker, includes the opportunity to bill for professional services like renewing a prescription, like preparing a care plan for a complex patient, and like working with other health professions as part of a team delivering care, Mr. Speaker.
The honourable member Strathcona.